This video is a closer look at the Semmelweis story, which is worth reviewing on a number of levels. There is absolutely no doubt as to the importance of Semmelweis's work and its important conclusion, the crucial role of hand washing and hygiene in medical establishments. We take it for granted these days, but antiseptic hand washing was not prevalent in the times that he lived in. This simple conclusion was poorly appreciated during his lifetime, resulting in many tragic deaths, including his own, making him a martyr in the area of medical science. This story is also a key citation in textbooks on the philosophy of science. But the story also offers other issues to explore, and this video will review some of them. Ignaz Semmelweis was a Hungarian physician who obtained his degree in medicine in 1844 and decided to specialize in obstetrics. He was first appointed to a position equivalent to head resident at the first obstetrical clinic in the Vienna General Hospital in 1846. This was a joint medical and administrative position. The maternity unit of the Vienna General Hospital had been set up to care for infants of the underprivileged, and at the same time it served as a training ground for future doctors and midwives. The clinic consisted of 2 wards, and they had significantly different mortality rates. Since the 17th century, postpartum infections were a common and deadly occurrence in maternity hospitals throughout Europe. At that time, these infections were more commonly referred to as puerperal fever or childbed fever, and they resulted in an excruciating death. In 1845, Semmelweis's predecessor, Edward Lumper, published a report echoing the current opinion that the disease was an epidemic subject to harmful atmospheric conditions, even though there were differences in mortality rates between the 2 adjacent wards. This was despite the fact that the obstetrician Alexander Gordon of Aberdeen, Scotland, had already suggested in 1795 that midwives and doctors who had recently treated women for puerperal fever spread the malady to other women. In 1843, the Harvard anatomist Oliver Wendell Holmes published The Contagiousness of Puerperal Fever, where he proposed that the disease was spread by physicians and recommended that they abstain from performing autopsies on women who had died of puerperal fever. As can be seen in this slide, the first maternity division had about 3 times as many deaths as the second division. In fact, in many hospitals, the mortality rate was much higher than at the Vienna General Hospital. The first division was staffed by male doctors and medical students, while the second division was staffed by female midwives. This difference was publicly known, and Semmelweis recorded that female patients were so scared of the male-staffed clinic that when they found out that they had entered this clinic by mistake, they would, kneeling and wringing their hands, beg to be released in order to seek admission to the second clinic. So Semmelweis set about trying to resolve this problem. He recognized that the 2 clinics were subject to the same atmospheric conditions, so the disease could not be epidemic. He then looked for other factors that could be responsible. He looked at causes such as overcrowding, the rough handling of patients, specific medical procedures, inadequate ventilation, dietary differences, and various psychological conditions, and systematically ruled them out. Another piece of relevant information was that women who delivered their babies at home or on the way to hospital in a street birth had a much lower incidence of this disease. Semmelweis was finally inspired by a tragic accident that occurred to one of his close colleagues, Dr. Jakub Kolečka, who died after being stabbed accidentally by a student during a post-mortem examination. It's worth mentioning here that conducting an autopsy in those times must have been an extremely unpleasant and confusing task. Before the first use of formaldehyde at the end of the 19th century, doctors would be working on decaying flesh in a foul-smelling environment. Kolečka's autopsy revealed similarities to those of women dying from puerperal fever. On this basis, Semmelweis surmised that there must be a connection between cadaveric contamination and puerperal fever. Medical students would often perform autopsies before examining patients in the first obstetrical clinic. The midwives in the second clinic did not perform autopsies, and the clinic thus had a lower mortality rate. The theory of germs had not yet been proposed, but Semmelweis created a policy requiring his students to wash their hands with chlorinated lime before examining their patients. As a result of this policy, the mortality rate in the first clinic declined significantly. Despite this dramatic improvement, there was still much resistance to his suggestions. Semmelweis had a difficult personality and had a poor relationship with his peers. He also refused to publish his findings until 13 years after making them. He eventually lost his clinical appointment at the Vienna General Hospital, and in 1850 abruptly left for his native Budapest. In 1861, he finally documented his experiences and conclusions in his book, The Etiology, Concept and Prophylaxis of Childbed Fever. The last part of the book is devoted to acrimonious attacks on his critics. As his views were already widely known by that time, the book was largely ignored. This was unfortunate, as the first part contained exhaustive evidence supporting his claim. Over time, his behavior became more and more erratic, and he was finally committed to an insane asylum, dying 2 weeks later on August 13, 1865, at the age of 47. The importance of his work was only fully appreciated after the acceptance of Louis Pasteur's germ theory and the institution of Joseph Lister's practice of antiseptic surgery. Semmelweis's work was also brought to prominence in the philosophy of science, especially by Karl Hempel. Karl Hempel was a philosopher of science, a member of the prestigious Vienna Circle, and later professor at Yale and Princeton, who described his work as logical empiricism. Hempel quotes the case in his book, The Philosophy of Natural Science, and he looks at it from the point of view of the role of logic and empiricism in scientific discovery. Semmelweis made hypotheses and he tested them. Amongst his hypotheses, he considered crowding as a possible reason for the disease. The second midwife-only clinic was more crowded than the first, so this immediately ruled out this hypothesis, and he needed no test. He also considered the position of the women during delivery, which was different in each clinic. He performed a test of this hypothesis by making both clinics adopt the same position. This did not affect the rate of mortality, and so this hypothesis was rejected. This method can be summarized as follows. If a hypothesis is true, then it follows that the implication must also be true. But a test shows that the implication is false, thus the hypothesis is false. This is an example of deductive logic known as modus tollens. But the most interesting part comes when we consider a situation where the implication turns out to be true. In Semmelweis's case, his hypothesis was that childbed fever was blood poisoning produced by cadaveric material. The test and the logic can be represented as follows. If the hypothesis was true, then removal of the cadaveric material would reduce the mortality rate. The test showed that the implication was true, thus the hypothesis was assumed to be true. However, Semmelweis was himself later to prove that this was not a unique conclusion. On one occasion, he and his associates, after carefully first disinfecting their hands, examined a woman in labor who was suffering from a festering cervical cancer. They then examined 12 other women in the same room, without renewed disinfection. 11 of the 12 patients died of puerperal fever. Semmelweis concluded that childbed fever was not uniquely caused by cadaveric material, but could also be produced by putrid matter derived from living organisms. When we look at these two syllogisms side by side, it is easy to imagine that by symmetry they are both correct. However, his original hypothesis was not exhaustively true, because he showed that matter from living organisms could also cause puerperal fever. This was called the fallacy of affirming the consequent. At this point, Hempel's philosophy rapidly goes outside the scope of this video. But the point I'm trying to make is that the Semmelweis story has literally been used as a textbook case to justify the role of Enlightenment science in medicine. The reality of this role is much more complex, and I will expand on this in my next video. What is important and should be noted is that although Semmelweis's experiments did not establish a correct scientific explanation, to his credit they did help to establish a practical action or rule that reduced mortality in hospitals. A better scientific explanation came some 20 years later from Koch and Pasteur in the form of germ theory, even though we can all recognize Semmelweis's approach as being scientific. Stigler's law of eponymy states that no scientific discovery is named after its original discoverer. Mark Twain made a comment that is perhaps even more relevant to the Semmelweis story. It takes 1,000 men to invent a telegraph, or a steam engine, or a phonograph, or a photograph, or a telephone, or any other important thing. And the last man gets the credit, and we forget the others. So let's return to a person I mentioned earlier in this video. Alexander Gordon was born in 1752 on a farm in Scotland. He got an arts degree at the University of Aberdeen, but became interested in medicine. He started study by walking the wards in Aberdeen Infirmary, and eventually obtained a certificate of proficiency from what was to become the Royal College of Surgeons. He spent 5 years in the Navy as a surgeon, and returned to a post of physician at the Aberdeen Dispensary. In 1795, he was recalled to serve as a surgeon in the Royal Navy. He died of pulmonary tuberculosis in 1799. In his time at the dispensary, Gordon witnessed 2 epidemics, erysipelas and puerperal fever. He realized that these 2 diseases were related, and that both were the result of interhuman contagion, rather than arising from a noxious constitution of the atmosphere. It was his detailed note-taking that enabled him to come to this conclusion. He recorded the name of every doctor and midwife who examined a patient, and by correlating this information he was able to follow the diseases. He even confessed that he himself had also been a vector of the disease, which he suspected was transmitted by putrid particles, copiously admitted by numerous patulous orifices. To counteract this, he instituted various preventive practices, including the burning of contaminated material as well as careful washing. Unfortunately, his detailed note-taking, which named patients and midwives, created an open hostility towards him. Nevertheless, it was this that clearly demonstrated the contagious nature of puerperal disease. Oliver Wendell Holmes quoted Gordon. Semmelweis did not, probably due to the lack of translated material. Both Gordon and Semmelweis used methods basic to scientific progress. Gordon employed meticulous note-taking and correlation. Semmelweis used experiments that allowed him to reject or accept a hypothesis. If we compare how the 2 men were commemorated, we can see that Semmelweis has received many accolades since his tragic death. In addition to these, there are a number of movies about Semmelweis, and as of the publishing of this video, the National Theatre in London is presenting a play about Semmelweis. Alexander Gordon, on the other hand, is commemorated by a single plaque at one of his places of residence. We don't even have a portrait of the man. Thank you for watching this video, and I hope you'll join me for part 2 and other videos in this series.